Okay, which of the following is the most appropriate next diagnostic step? A 40-year-old woman with no significant medical history presents to her primary care physician with a 4-day history of fever, chills, and productive cough and left-sided chest pain. On examination, her temperature is 101.5, heart rate 110, respiratory 22, and oxygen saturation on room air is 94. Auscultation of her lungs reveals decreased breath sounds and dullness to percussion in the left lower lung. Which of the following is the most appropriate next diagnostic step? You always told me that what's going to give you the most information, right? Like that's how I should think about these questions.
Sure.
Um,
By the way, I'm gonna a little caveat here. Once again, a little bit higher order question here. Of course, next steps in management. Well, I guess this. I mean, most appropriate next diagnostic step. This is a little bit more step two, but let's. I want to see kind of what you're thinking here.
yeah, so no past medical history. 4-day history of fever, chills, productive cough, and left-sided chest pain. I mean, okay. Um,
So think about diagnosis first. What you know?
Yeah. Again, to me, I feel like a lot of these are just so here the thing I could go with is dullness to percussion, which is a lot of things. Um, Decreased breath sounds. Uh, no. Fevers, chills, productive cough, left side chest pain. Maybe some type of pneumonia. I don't
Yeah.
know.
Okay. Good. Yeah. Yeah. I think in your mind you should be thinking broader in a sense, right? In a sense, you're like, okay, this is probably infection, right? Some
Yeah,
kind of
it's
lung
yeah,
infection.
exactly.
Okay.
And
So start with
so
that.
with that, CT scan of chest X-ray. I mean, I guess you could get a honestly, and this is embarrassing to say, I really don't know the huge difference between like what a CT will tell you. I just know they say like, here's a CT scan or whatever, and so like, honestly, I don't think PFTs or ventilation perfusion scans would crazy help. Maybe they would. I would probably go something that doesn't involve invasive procedures
Okay.
first.
Good.
I would go with
Good.
chest X-ray or CT, and I'd probably go with chest X-ray
Final
over.
answer.
Yeah.
Yeah, great answer, Troy.
Let's go.
So yeah, work. So see, you're becoming a clinician, all right? So we'll work through this, right? So you guys be thinking, oh, it's infectious in nature, right? It's an acute setting, right? Fever, dullness to percussion. So there's probably some kind of pus in the lungs or pneumonia in the lungs, right? And
Mhm.
in this case, it's probably a lobar pneumonia, correct?
Yeah, like
Right?
left side chest pain localized to one area.
Exactly. So you're thinking not a walking pneumonia or an interstitial pneumonia. You're thinking about a lobar pneumonia, which is this is how you should be thinking. You should be thinking, oh, okay, that's probably like let's just say like you're taking it to the next level. You're probably like, oh, that's strep pneumonia. Now, how do I confirm that's a lobar pneumonia? What's the least invasive,
Yeah.
right? On not only on a procedure standpoint, but also on a radiation standpoint. Am I going to get the same confirmation with the chest X-ray versus CT? CT gives you more detail, but it exposes you to more radiation. And if you notice, right, when have you learned that you need to diagnose a pneumonia with a CT scan? It's usually with a chest X-ray because it gives you plenty of information without giving for one, I mean, the radiation. For two, it doesn't in a sense tax our healthcare system too much dollar wise, right? An X-ray is like a very simple thing and not too costly. So
Cool, man. It makes me feel good that I can get that one right.